So turn next to Senator Scott.
Thank you, Chair. Mr. Ganga, how does your facility assist veterans and their caregivers when the veteran wants to remain in the home but still needs some additional support?
So our adult day health care program is a phenomenal program. It allows for the veteran to keep his or her own physician, whether they be with VA or whether they be in the private community. We think we do provide a tremendous service to these veterans 6 days a week. I'd like to give you an example, Senator Scott. When the veteran is in our adult day health care program, it's a 6-hour visit. They arrive at 9 a.m. and they depart around 3 p.m. During the course of that time, we can get a lot done for that veteran. Think about someone who's caring for their elderly parent or grandparent who is a veteran. While they're at the home, they can receive phlebotomy because the doctor ordered a blood test. They can receive a simple x-ray or ultrasound. They can get their teeth examined and cleaned. They can get their eyes checked by our optometrist. They can receive podiatric care and even receive physical therapy, occupational therapy, and speech therapy. Maybe their hearing aid needs a battery change. They can even get a haircut. What I just said to you, I just saved the caregiver about 11 trips in the community. That's what we tend to do in the State Veterans Home Program and our medical model adult day health care program. We are keeping veterans out of the emergency room, avoiding hospitalization, and we're certainly delaying placement into skilled nursing facilities. Thank you.
Thanks for what you do. Ms. Sawyer, what is the biggest challenge for caregivers in assessing benefits from the VA?
I'm going to assume you mean caregiver benefits, which are actually, caregiver benefits actually fall on the health care side. And some of the biggest problems with those really have to do with the evaluation itself. I would tell you that the law itself doesn't have many problems. The regulation itself has many problems, the implementing regulation. And one of those problems is the language that VA created around each and every time with ADL assistance. It prevents a veteran from showing any independence at all should they be able to toilet by themselves once in the entire 6 months. That prevents them from being eligible for each and every, for ADL assistance for that ADL because it doesn't meet the standard of each and every time. So one of the requests has been that the regulation be changed from each and every time. However, each and every time is actually in the regulation, not the law, but it was upheld by the courts. Because we have seen VA change this regulation multiple times, we've actually asked that Congress codify that it be regular instruction instead of how it's broadly worded in the law now. For supervision, protection, and instruction, that standard was also continuous daily care. A lawsuit, the veteran warrior lawsuit, actually overturned that and created that, said that regular instruction, forced it back into regular instruction, which was the standard in the law. We would ask that that once again be codified within statute so that VA cannot make that change again regulatorily. There's also a standard that VA has put in the regulation that in order to be the higher standard, that a veteran must be unable to self-sustain in the community. We ask that Congress make a little bit of change to that wording, even though it's regulatory language, because currently VA employees don't interpret that correctly. We've asked it to be evaluated multiple times, and what we keep finding is that it continues to be the bane of everyone's existence to get that to that higher level of acceptance. One of the other problems is that folks don't know the options that they have available to them. So if your family caregiver isn't able to perform those duties or needs assistance because, let's say, you're a trades invented veteran who needs 24-hour-a-day care, your caregiver, it is impossible for them to provide 168 hours of care per week. So the best thing to do would be to have VDC care, home health aid, respite care, a combination of such for those hours. What we have found is that there are matrices that VA has in place that govern the amount of hours that you have for GEC programs. Then there are matrices for the hours for PCAFC programs, and then there are matrices that govern how those programs interact together. They, however, apply differently to different generations of caregivers currently. And so it is a confusing maze as to what's available. And to top that all off, those hours differ between different VISNs or regional medical communities within the VA. To go back to an earlier question for just a second, when someone was asking about caregiver wages, there is a mechanism within the VA for your local VA to request, or VISN, to request an increase in home health care workers' reimbursement rates. Most VAs, however, do not know how to engage that mechanism. But one way that you could eliminate or lower the shortage of home health care workers is to increase that reimbursement rate so that more people would be willing to take those jobs. And if you look at the current reimbursement rates around VA, in the state of Alabama, the current reimbursement rates are $30.50 an hour. I'm so sorry.
Just to wrap up,
Yep.
only because we're over time, I'm
Yep,
sorry.
sorry.
Senator Scott, thank you.
Thank you.
We'll turn next to Senator Murray.